I do think that the adoption of virtual healthcare is going to continue to evolve. There are a lot of folks had access to virtual care, and a lot of people really liked it.
Hi, everyone. I'm Matt Iles, President and CEO of AHIP.
And I'm your co-host, Laura Evans. This season of The Next Big Thing in Health is sponsored by Teledoc Health, partnering with health insurance providers to transform the care experience for their members. Visit teledochealth.com/AHIP-2021 to learn about its perspectives on the path forward for integrated virtual whole person care.
Today, our guest is Chris Priest, Vice President of Medicaid Solutions at Centene. Previously, he was Deputy Director for Medical Services with the Michigan Department of Health and Human Services. In that role, he also served as Michigan's Medicaid Director, overseeing several healthcare programs, including My Child and the Healthy Michigan Plan. Chris, thanks for joining today.
Great to be here.
Well, why don't we go ahead and jump right in? And we all know that Centene is the largest Medicaid managed care organization in the US, or maybe those who didn't know, now they do. For our guests who might not know what separates managed care programs from the traditional Medicaid program, maybe you could just share some insights.
Yeah, Medicaid managed care, is a model that it aligns financial incentives with health outcomes, and it leverages a public-private partnership that can foster competition, choice, and really innovation. Managed care provides a cost-effective and comprehensive model of care. And, today, about 2/3 of all Medicaid beneficiaries are actually enrolled in some form of managed care. And increasingly, states are looking towards managed care to really address issues with more medically complex populations, high need beneficiaries. So when states contemplate their delivery system decision, it's critical to recognize really the value that Medicaid managed care offers for creating efficient, effective, and sustainable programming while also improving outcomes for folks.
And Chris, what are some of the benefits of Medicaid managed care?
Yeah, it's a great question. Fundamentally, it's about program sustainability and improving outcomes for members. So, for example, Medicaid now pays for, oh my gosh, it's something like 45%, I think, of all births nationally. And as the largest Medicaid managed care plan, I think in 2019. We covered something like 260,000 births. And, really what we've strived for is to really improve outcomes. So, for example, our Start Smart for Baby program is, a multifaceted approach to improving prenatal and postpartum care. That includes things like early identification of pregnancy, enhanced member outreach, sharing wellness materials, intensive care management, collaborating with our provider partners, and the appropriate use of medical resources. And that program has shown a statistically significant decrease in low and very low birth weight pregnancies, which also reduces NICU stays. So not only are programs like that, innovative, but they're improving outcomes, and ultimately, because you're avoiding some really high cost situations, you're also helping, save resources.
So it's great to have a former Medicaid director with us today, which I think gives you, Chris, some unique insights into how different stakeholders think, and especially from the state side. What do you think states are looking for when it comes to a health plan partner, and what solutions do you think they're most interested in?
Yeah, look, I think I'm going to sound a little bit like a broken record, but it's really about innovation and outcomes. They want managed care plans to innovate, to improve member engagement, to improve health outcomes, to address things like social determinants of health at a greater scale and at greater speed than fee-for-service could. So let me give you an example. So our Arizona plan implemented a program to connect members to stable housing, leveraging the homeless management information systems to locally coordinate and prioritize housing, for members. When they fund engagement specialists that can work with members. And after about 6 months of this program, we were seeing rates of homelessness, start to decrease. And with that, we also saw, healthcare costs decrease because people were stable. And that kind of whole health approach, especially during the pandemic, where it's really highlighted a lot of the challenges within the system. That kind of approach to, being innovative, driving towards member outcomes and improving their overall well-being to help members live healthy, productive lives. Those are things that states, I think, are really interested in, and where a lot of managed care plans, Centene especially, is very focused on.
Mm-hmm. Chris, this pandemic has really exposed some of the longstanding health inequities in our country that a lot of people really weren't aware of and have finally woken up to. We know that social determinants of health plays a big role in those inequities. How is Centene working to address the social determinants of health, which you just talked about, in the communities where you operate?
Well, I mean, it really is, for us, it really is about that local approach. Every state has unique challenges. Every community has unique challenges. And we take to heart, our mission is to transform the health of the community one person at a time. And we truly believe that our mission is to do just that. So when we talk about like social determinants of health and some of the things that have been highlighted during the pandemic, maybe a couple examples would be a good thing. So like, let's try like food insecurity. USDA, I believe they had a report that said something like 40 million Americans are face hunger, including more than 12 million children. So what we've done is partnered with organizations like Feeding America to launch programming to not only equip food banks, but also our health plans with best practices and guidelines for meeting the needs of our individuals who are experiencing food insecurity. We were, especially during the pandemic, like you mentioned, Laura, we were trying to help our members also stay connected with, family and friends to really support and address things like social isolation. So, I think we gave something like 13,000 prepaid cell phones with data services to patients through providers. We distributed, 65,000 gift cards to individuals to help them purchase essential items, knowing that if we're able to address those issues, the social issues, it also drives, again, better outcomes for members. Mm-hmm. And so a lot of those efforts are things that we have really taken to heart during the course of the pandemic. And we've really accelerated our commitment through efforts that include everything from expanding broadband to helping support housing, like I talked about earlier, and food insecurity, social isolation. I mean, really, this is core to our mission.
And just to follow up on that, are those programs things that you will continue to keep up as the years go on, pandemic or not?
Yeah, I mean, I think that we talk a lot about our whole health approach to care, and it's something that it really is trying to meet the unique challenges of those communities. Again, going back to our mission of transforming the health of the communities one person at a time. And so it's not just physical health or behavioral health. It's also social health.
Mm-hmm.
Yeah, and Chris, I think you highlight such an important point here about the connection between whether it be physical and mental health, social issues. Maybe you could just dig in a little bit more. I know Centene talks a lot about whole health solutions in terms of some of the other ways that you're approaching whole health for your members.
Yeah, I mean, like I said, it's physical health, behavioral health, it's social health. Let's talk about the food example we talked about a second ago. For adults living at or below around the poverty level, lower food security is directly associated with significantly higher probability of chronic diseases, hypertension, heart disease, stroke, cancer, diabetes, kidney disease. If we address those issues of things like food security, then outcomes will improve along with it. And so we are working with our state partners, with our provider partners, with our members to try to make sure that we are addressing the needs and the unique challenges in the community. But we're doing it in a very local way because you have local partners who are, we have national partners as well, but we also have local partners that we want to work with to help transform the health of our communities. And it's so critically important, especially now, as we continue to come out of the pandemic, it's I think more than ever, that approach is really not only what states are looking for, but what members are looking for in order to live healthy, productive lives.
Mm-hmm. Let's talk about COVID for a second and vaccines, because that's where everybody's head is right now, is on the vaccines. But vaccine hesitancy is, of course, still a big issue in this country in many communities. How is Centene addressing the issue of vaccine hesitancy?
That's a great question, and strongly encourage everybody to go out and get the vaccines. They are safe, they are effective. It is something that, I've been vaccinated. I got to tell you, when I was fully vaccinated, it was like a weight was off my shoulders because
Yes.
now I was like, I can start to see getting back to normal. But it's not only encouraging our friends and neighbors, it really is, reaching out to folks. So we've partnered with the Pro Football Hall of Fame to do public service announcements, encouraging individuals throughout the states, throughout the country, to really go get vaccinated so that we can put this pandemic behind us and begin to continue to get back to normal, moving back into the future. We're also reaching out to members. We want to make sure that all of our members have access to these, amazing, safe and effective vaccines. So, I think overall, really, it's about outreach, providing access, and Centene is committed and actively working with our state, our federal partners to try to make sure that everyone has access.
Teledoc Health, the leader in virtual care since 2002, has built the only scalable platform for integrated whole-person solutions. A partnership with Teledoc Health helps ensure that health insurance providers, employers, hospitals, and health systems are prepared for the future by supporting the growth of virtual care. To learn about Teledoc Health's perspectives on innovating to ensure access to integrated, virtual, whole-person care for everyone, visit teledochealth.com/AHIP-2021.
So access is so important, Chris. And maybe, through the pandemic, we've seen the role of telehealth in terms of it being so important. Maybe you could touch on how telehealth is working for the Medicaid population, because I know that's a big important area for so many companies and, just people who need access to care.
So when the pandemic started, it was, there, concerns about access were justifiably raised. And I think what you saw in a lot of states is many states took actions that if there were, like regulatory barriers and things like that would, prohibit access to telehealth, that a lot of those barriers were broken down. And so I think what we've seen are dramatic increases in the use of telehealth. And we, worked with our federally qualified health center partners and others to try to make sure that we were giving access to our members in an effective way. There's just so much. I think we gave, $5 million, I think, to the Medicaid Telehealth partnership with the National Association of Community Health Centers to better enhance solutions and meet members where they are, especially given that, the federally qualified health centers are where a lot of Medicaid members, access care. So working collaboratively with our provider partners, working with, national vendors, we've been able to, increase access to telehealth, for our Medicaid members. And I think this is something that's it's going to continue to evolve. I don't know about you all, but I actually had a telehealth visit during the pandemic, and it was great. There was no waiting rooms. I was able to talk to my doctor and laying in my bed. So it's something that I think is going to increasingly be utilized, and it's going to continue to evolve, Matt.
Yeah, I think you're absolutely right. And that's, I think, a perfect segue into the last question that we ask all of our guests. And so from your perspective, Chris, what do you think the next big thing in health is? And this could be about Medicaid managed care or something more broadly.
Oh my gosh, there's so much I can say on this topic. Where do I even start? Well, like we talked about, I do think that the adoption of virtual healthcare is going to continue to evolve. There are a lot of folks had access to virtual care, and a lot of people really liked it. The satisfaction was really high. And so what that means as our entire healthcare ecosystem continues to evolve as we come out of this, I think it has the potential to really improve access, whether it's rural areas or whether it's for working families who may not have time, may have time constraints because they're not able to leave their job, whether they're working in person or virtually. It's good. I think this is going to continue to evolve. It's going to continue to be important as we come out of this. And I think it's here to stay, but it's going to continue to evolve over time.
Thank you so much, Chris. We really appreciate your time and your insights and unique perspectives. So thank you so much for being with us.
Yeah, thanks for having me. Great to talk with y'all.
Recognizing the critical role that virtual care plays in the healthcare delivery system, Teledoc Health helps health insurance providers coordinate and deliver care for all members, including their highest risk populations, by providing a front door to care. From chronic condition management to mental health to primary care, Teledoc Health personalizes and integrates whole person care for members. Visit teledochealth.com/AHIP-2021 to download our brochure and learn how virtual care is delivering value as the preferred entry point to health.
Thanks again for tuning in to this episode of The Next Big Thing in Health. Be sure to sign up for our email list at ahip.org/nextbigthing. Subscribe and share with your friends too. Thanks for listening, and see you next time.